I need you to stop what you're doing. This episode is not going to be an easy one for me. I'm not a huge social media person, but I do use it for research. And lately, on TikTok in particular, I see accounts of people with various types of disabilities, or even accounts of people who are caregivers to someone with a disability. In some cases, you see video of what these people go through, both the ups and the downs. But what really breaks my heart is seeing someone watch their loved one have a seizure, and there's nothing that they can do about it. If you're like me, you can't help but feel helpless. As human beings, we are empathetic to someone else's suffering. But what I'm about to expose today will make you angry, just like it has made me. If you have a family member with epilepsy, I need you to hear this. If you have a child with autism, I need you to hear this. If you are a caregiver, exhausted, scared, doing everything you can to keep someone you love safe, I need you to hear this most of all. Because there are companies out there right now marketing themselves as the answer to your fear, who are not primarily in the business of helping you. They are in the business of collecting your family members' brain data and selling it. We live in a world where the most powerful technology ever built is being handed to you without instructions, without warnings, and without anyone asking whether it serves you or uses you. That question has a name: the Virtuous machine. I'm Michael Ruthier, and this is Tech for Grownups, the show that believes technology should answer to human beings, not the other way around. This is the show the tech industry doesn't want you to hear. No corporate talking points, no sponsored opinions, just honest conversation. Let's go. I want to start with something Marcus Aurelius wrote. The first rule is to keep an untroubled spirit. The second is to look things in the face and know them for what they are. Now that second part, look things in the face and know them for what they are, not what they claim to be, not what the website says, not what the marketing tells you when you're scared and desperate and searching for something, anything that might give your family member a few more seconds of warning before the next seizure hits. What they actually are. Because there is a category of technology company that has learned something very specific about human vulnerability. They have learned that a frightened caregiver will read a headline and stop reading before they get to the fine print. They have learned that a parent of a child with a neurological condition will pay almost anything for the feeling of control in a situation that feels completely out of control. And they have learned that the words artificial intelligence placed next to the words seizure prediction or neurological monitoring will generate investment, generate headlines, and generate customers. Whether the product actually does what they say or not. Here is the business model I want to describe for you today. And I want to be very clear about this. I am not describing one specific company. I am describing a pattern, a business model that is spreading across the medical wearable industry. And once you understand it, you will recognize it everywhere. Here's how it works. Step 1, you identify a vulnerable population. Epilepsy patients, autism families, caregivers of adults with dementia, people with chronic conditions who are afraid, who are underserved by the existing medical system and who are actively searching for something better. Step 2, you build a product, typically a wearable device, a headband, a smartwatch, a sensor patch, something that sounds high tech. It looks impressive and connects to an app on your phone. You put the words AI powered in the product name or description. You build a website that features smiling families, testimonials. The word pioneering appears at least twice. Step 3, you market that product directly to the vulnerable population you identified in step 1. You use language like predict seizures before they happen, give your family member the gift of safety, take back control. You put families front and center. You make it emotional because it is emotional. These people are living with real fear, and your marketing speaks directly to that fear. Step 4, you include a disclaimer, usually buried, usually in legal language on a product page that most people, they don't read past the headline. The disclaimer says something like this, and I'm going to read this kind of language very carefully so you understand what it actually means. This is a wellness-oriented platform. It is not a medical device. It is not intended to diagnose, treat, cure, or prevent any disease, mental health condition, or neurological disorder. Now read that again. Not a medical device. Not intended to diagnose or treat neurological disorders. The product that was marketed to you as predicting seizures cannot, by the company's own legal admission, diagnose or treat a neurological disorder. Those two things cannot both be true at the same time. But here is what that disclaimer does, though. It protects the company completely. If the device fails to predict a seizure and your family member is hurt, the company points to the disclaimer. They were never a medical device. They never claimed to be. Read the fine print. You were the one who misunderstood. This is not a technology company. This is a liability management strategy dressed up in a headband. But here's the part that makes me genuinely angry. That's not even the real business. The product, the device, the app, the monthly subscription, that's the front door. That's what gets you in. That's what gets your family members' brainwave data flowing into their system, into their servers and into their hard drives. The real business is what happens to that data. Now, I want you to understand what brainwave data actually is, because the companies selling these products are counting on you not thinking too hard about it. Your brainwave data is not like your email. It is not like your location history. It is not like your browsing behavior. Your brainwave data is a direct readout of your neurological activity. It captures the electrical patterns of your brain in real time. And when collected continuously over days, weeks, months, it builds a neurological profile of you that is more intimate than almost anything else that exists. Your brainwave patterns can reveal your emotional states, your cognitive load, the signature of your specific neurological condition. Now, how your brain responds to stress, to medication, to different environments. This data is extraordinarily valuable to pharmaceutical companies, okay? The pharma companies developing new epilepsy drugs who need real-world neurological data from actual patients outside of a controlled clinical trial. to medical device manufacturers developing competing products who need training data for their own AI algorithms, to academic research institutions who need large data sets to publish papers and attract funding. And these companies, the wellness platforms we're talking about right now, the AI monitoring startups, the seizure prediction apps, are selling it to all of them, all of those people. They are selling it to them and making money. That's with your consent, buried in the terms of service, the TOS you clicked through when you were setting up the device for your spouse at 11 o'clock at night because they had 3 seizures that week and you needed to do something, anything, to feel like you were helping. That is not informed consent. That is a signature extracted from fear. Epictetus, a man who was literally owned by another human being, wrote this: "Seek not that the things which happen should happen as you wish, but wish the things which happen to be as they are, and you will have a tranquil flow of life." I think about that a lot when I cover stories like this one, because I also have to control my emotion about it. Because the families using these products are not naive. They are not foolish. They are people in genuinely difficult situations, doing their best with the information that they have. Now, the tranquil flow of life that Epictetus talks about, that is what these families are searching for. Some semblance of safety, some feeling that the next seizure won't come without warning. Some small piece of control in a life that a neurological condition has made feel completely uncontrollable. And these companies have looked at that search, that deeply human, deeply understandable search, and they have decided it is a market segment. That is the thing I cannot, and I mean that, cannot forgive. Not the technology. The technology is not the problem. AI can genuinely help people with neurological conditions. Real, peer-reviewed, FDA-cleared, clinically validated technology exists, and it is being developed every single day by legitimate researchers at legitimate institutions. That technology has the potential to change lives. The problem is the companies that have put on the costume of that legitimate technology borrowed its language, borrowed its aesthetics, borrowed its emotional resonance without doing the work. Without the clinical trials, without the regulatory clearance, without the peer-reviewed evidence, without the honest disclosure. And then, you know what? And then aimed that costume directly at the most vulnerable people they could find. So here is what I want you to be able to do after today's episode. I want you to be able to walk up to any medical AI wearable product, any seizure monitoring app, any neurological tracking device, any brainwave headband, and ask 5 questions that will tell you immediately whether you are looking at a legitimate medical technology or a data harvesting operation wrapped in a wellness brand. Question 1. Is this product cleared by a regulatory body? Now, in Canada, that is Health Canada. In the United States, that is the FDA. In Europe, it is the CE Medical Device Certification. A legitimate medical device that claims to detect or predict a neurological condition will have regulatory clearance. It will say so clearly and prominently on the website, not buried in vague, not we're in the process of, cleared, number, date. If you can't find it in 30 seconds, it doesn't exist. Now, question 2. What does the legal disclaimer actually say? Don't read the marketing. Read the terms of service, the TOS. Read the product disclaimer. Specifically, look for the phrase, not a medical device or not intended to diagnose or treat. If those words are anywhere on that page, the product cannot legally deliver what the marketing is promising you. Those two things cannot coexist. Trust the disclaimer, not the headline. Question 3. What clinical evidence exists? Not testimonials, not case studies on the company's own website. Published peer-reviewed clinical research in a recognized medical journal. A study with a sample size, a methodology, a control group, a conclusion. If a company tells you their AI predicts seizures and they can't point you to a published clinical study that demonstrates just that, they are asking you to trust a claim they have not even proven themselves. Question 4. What happens to your data? Read the privacy policy. Specifically, search for the words sell, share, third party, research, and de-identified. If the company's revenue model includes selling that data collected from your family member to pharmaceutical companies or research institutions, that will be disclosed somewhere in the policy. It has to be. And if you find it, you now know what the real product is, and it isn't the headband. Question 5. Who built this, and what are their qualifications? A company claiming to use AI to predict neurological events should be led by people with neuroscience credentials, clinical medicine backgrounds, or deep, and I mean deep, regulatory expertise, not exclusively software developers and business executives. Come on. Not executive IT leaders with backgrounds in cloud infrastructure. The technology may be AI, but the problem it is solving is medical. And the people solving it should know medicine. I want to say one more thing before I close, and I want to say it directly to anyone in this community who is living with epilepsy or caring for someone who is, or has a child with autism and is desperately searching for something that helps. Your fear is real. Your need is real. The gap in the medical system that these companies are exploiting, the gap between what conventional medicine can offer and what families actually need, that gap is real. You are not wrong for searching, and no one can fault you for that. You are not wrong for wanting something more, but you do deserve technology that has actually been proven to do what it claims. You deserve a company that is transparent about what your data is used for. You deserve a legal agreement that says the same thing as the marketing. You deserve the truth, first and foremost. Even when the truth is that the solution you were hoping for doesn't exist yet. Now, Marcus Aurelius asked a question that guides everything we do on this show. What is this actually for? Not what it claims to be for. What is it actually for? When a company's primary disclosed revenue stream is selling the neurological data of seizure patients to pharmaceutical companies, the answer to that question is not helping your family. The answer is profit. And the moment you know that, you can make a different decision. Now, that's it for today's episode. If this conversation reached someone who needed to hear it, please share it. The people most likely to be targeted by this business model are the people least likely to have a tech-savvy person in their lives telling them what to look for. Be that person for someone today. Everything from this episode is at techforgrownups.com. Come find us in the free community. No pressure, no pitch, just honest conversation like this one. Stay sharp, stay loud, and don't, and I mean this, don't let anyone sell your family's brain data without a fight. This is Tech for Grownups. Make sure to tune in next week as we have a special guest on our show, Mr. Jack Smith from the IT Horror Stories podcast. You definitely don't want to miss this episode. See you there. Marcus Aurelius asked a question that I think about every time I sit down to record this show. What is it fundamentally that this thing is for? Not what it claims to be for. What is it actually for? That's the Virtuous machine question, and it applies to every piece of technology being built right now. The AI, the algorithms, the platforms, all of it. You'll find everything from today's episode at techforgrownups.com. Join the conversation in the community. The link is there. Stay sharp, stay loud, and I'll see you in the next one.